question number 1 to Wilma. Was there any recall bias that you could have noticed that could have affected your results? Question number 2 is to recall Ryan. Is this model associated with complications like pneumothorax? Thank you.
Okay, good. For the first question was for recall bias for who?
Wilma.
Wilma, Dr. Wilma.
Recall bias of the mother?
Yes, when you're collecting data. Remember, you're collecting data 2 years after birth. Was recall bias affecting your results?
There was not a recall bias because the question was asked to the mother, how is the child now? The study was 2 years after of that particular child, but the question was now, at this present moment.
Thank you. Second one?
Second, was it pneumothorax?
Pneumothorax, yeah.
Yeah. No, I mean, we haven't utilized these on patients quite yet. However, we're using basically the very, very typical flow rates and pressure rates I'd use on a neonate that are safe.
Okay. Please, before Luis, this one, and then Luis.
My question is to Laura. I can congratulate you for this successful project. I know that you said you didn't work on hard data, but do you have anything to compare with, like discharge rate improvement of, or nothing at all, before and after the project?
No. Short answer is no. We weren't, like the project when I got there was not even a year old yet, so it wasn't at the point of doing research yet, but it's something that hopefully can be done in the future. I mean, we know that just by word of mouth from the nurses and stuff that it was definitely more frequent, but as far as numbers for you, I don't have any.
Thanks. Luis, one?
Yes, thanks for the presentation. I have 2 questions. One for Wilma. I know quite well this project in Burundi. My question is to know if it's feasible or thinkable to compare with other realities of other neonates going out in the countries in order to see if it's quite a difference according to the quality or, let's say, the high performance in Kabezi. And the second question is for Ryan. Basically, do we know the price of this device? I think it's an interesting point to know as well.
Yes.
Thank you. Feasibility, well, first of all, now in Burundi is impossible due to the security situation. It's impossible to go and search for these children now in the collines of Burundi. And that also answers a bit of the question, is it feasible to, it was really, really hard to find 2 years after these patients back because there's a huge network, working network of community health workers who knew more or less the places of these families, but then going to the village and to find them was extremely hard. So I'm happy that we found 3/4 of the children. Now to compare them with a much larger group, of course that would be very nice. I think it's very nice to see that difference. You would need definitely much, much more time.
Thank you. Ryan?
Price of production is less than, well under $100 per unit, especially if I buy in bulk. And then there's a startup cost with several of those testing modalities and some basic tools to create an engineering team that can build and repair. But beyond those costs, well under 100.
Thanks a lot. Please, one or two last. One short last question with short answer.
She's tough.
This is for Anne. Thank you, very impressive results from Congo. Talking about hygiene, which things are most important for the hygiene measures? What actions did you actually take on? Did you have water in the hospital? Or?
Yeah, sure. So there is a water point just in front of the door to enter in the neonatal unit, and everybody has to go through there and to wash their hands before entering. That means mothers, nurses, hygienists, everybody. For sure, we do the normal hand hygiene inside.
Which is?
Oh, that means solution hydroalcoholic solution for the hands between each child, for sure. The mother also, we care that they do everything well. They have also a gown, a pink gown that they had to put on. We teach them also hygiene to the mother, for sure. And we do big cleanings every month. That means every month we put everything outside. We clean everything, and we put the again inside. That we do a turn with it. And yeah, things like this. Right.
Thank you very much. If you would be in Barcelona, we would continue. But in Sweden, we stop. Thank you very much. Thank you.